Hello, sir.
Hello, Doctor.
I'm Dr. Ritchie. I'm one of the doctors on the ward.
Yes, I've seen you around, yes.
Great. I believe you've asked for a bit of a chat about what's going on.
Well, I'd just like to know. Nobody sort of told me. They've done various bits of tests and things, but nobody's said anything much to me at all about what's happening. So I was just wondering where we are at the moment.
Okay. Before I go things, I know we've seen each other around, but
Yeah.
can I just double check your full name, sir?
Peter George.
Okay.
Yes.
And your date of birth, sir?
It's the 2nd of February 1968.
Okay, great.
Yes.
So, sir, could you just recap for me, just so I know what you know, what's brought you into hospital and what's happened to you?
Not a lot, really. Recently I've been tending to feel rather unwell, and then last couple of weeks I started this cough, which is a bit of a nuisance. It's not too bad, but it's, a little bit of a nuisance. And went to see the GP, and he did some tests, and something about oxygen levels in the lung or something, which I didn't really understand. But this is why I was really referred to a hospital. And he was asking about weight too, but because I have lost a bit of weight recently,
Okay.
So it's sort of generally unwell and a bit of a cough, really. That's really all there is to it.
Okay.
Not a great deal.
And have you been ill in the past? Or?
No. I've always been
Always
very
been
well,
good.
fit. I travel a great deal with my job, and I've always kept pretty fit.
Okay. What's your job?
I travel around. It's sort of, I suppose it's sales and representing my business. We sell agricultural equipment, but it's on a worldwide basis, and travel in Europe and Far East and States sometimes. Are trying to get in that market as well.
Right. Okay. And on your travels, have you been exposed to anyone who is unwell that you think?
No, nobody I can think of. No.
Okay.
No.
And you mentioned that no one's really sort of given you a lot of detail about what's going on.
No. I suppose they haven't had the results yet, so they haven't. They've not really said what they were looking for, but.
Do you have any ideas yourself?
No, not at all, really. The cough is just one of those things. It's a bit of a nuisance, and the weight loss, I'm not so sure where that could come from, but probably not a bad thing in any case.
Okay. And anything you're particularly worried about that you want me to specifically address?
I presume we've got the test results and things like that. The GP seemed rather bit cagey about what he thought was going on.
Okay.
And I did wonder whether, I sort of tried to be fairly positive about it, but I did wonder, whether there was something a little bit more. But no, I don't suppose there is.
Okay. Well, we have got your test results.
Right.
And I think we've got a very good idea now of what's going on.
Okay.
So before we start discussing that in detail, is there anyone that you'd like to have with you just to help you ask questions or to act as a second pair of ears?
No.
Okay.
No, my girlfriend's at work, and yeah.
Okay. Well, I think what we need to do is stagger the discussion, and I think what I'd like to first explain is why you've been short of breath and what's brought you into hospital in the first place.
Sure.
And then, secondly, I'd like to explore the causes for that having happened.
Right, okay.
So you've been, as you've said, sort of really out of puff, and we found a chest infection.
Yeah, okay, well that would fit in with the cough, wouldn't it, and things? Yeah.
The cough and the shortness of
Right,
breath.
okay, well that's not too bad, is it?
Well, this is something that we can treat, and
Yeah, good.
you are either already on or we'll start you on appropriate antibiotics for
Yeah,
this.
sure.
Now,
Oh, right, okay.
what we have to then think, though, is why a 45-year-old who's fit and well,
Yeah.
really, and out and about, could have got a chest infection, because actually that's not really sort of standard. You don't see that, I'm sure, in a lot of your friends and colleagues.
Well, I suppose I've not really thought about it, to be quite honest.
Okay. When we find that someone's got a chest infection, we try and find out what organism, what bacteria has caused it, because that helps us plan the best treatment.
Yes, of course. Yes, I can see that.
What we found for you is a bacteria that actually tends to cause infections in people whose immune systems are quite reduced and not working as well as they should be.
Oh, right.
And that's why you've got this infection and you're feeling so unwell with it.
Is that why I'm feeling unwell? Yes. So
Yeah.
what would bring that about?
Well, there are lots of causes of reduced immune systems. Are you aware of any of these?
Well, no, don't think so particularly. No.
Okay. One cause that we would always worry about is whether there's an infection reducing the quality of your immune system.
You said I got an infection, didn't you? This chest infection, would that be doing it?
No. That would be making you feel very unwell. I've got absolutely no doubts about that. But this is an infection that can come because your immune system is already reduced. So what we've got to think is one step back.
Right.
Has something reduced your immune system
I
that's
see.
caused this infection to happen? One condition that reduces immune systems, which a lot of people have heard of, is HIV. Now, is that a term that you're familiar with?
Are you saying I've got HIV?
We've done the tests and you do have HIV, yes.
Oh, God. Are you quite sure?
I'm as sure as I can be, yes.
Oh, that's awful. I mean that is, and this has broken down the immune system, and this is why I'm catching stuff, and this is, I mean, oh dear.
Okay. I can see this has shocked you, and I understand why. Are you happy to continue talking and we can discuss what the next steps will be in terms of treating
I'm not happy, but I mean, obviously, I need to see what can be done about it. I couldn't have dreamt of HIV. I mean, oh no.
It sounds like, from what you're saying...
But shall I tell the girlfriend?
Well, that's something that I think we are going to have to discuss. What I prefer to do first is just to talk about you and to try and get an understanding of what you're worrying about at this point and what we can do for you, because this is a disease that people have a lot of preconceptions about, many of which have changed over the years. So
yeah, but it's still pretty bad, isn't it? I mean, and you can pass it on to people, can't you? And yeah, go on.
What's your first thought? What are you? So obviously your first thought is the risk of having passed it on. Is there anything else that sort of has immediately sprung to mind that you'd like me to address?
Well, I mean, you're saying that, it still is. You said things have changed, but it is still quite a serious condition. I mean, it is something that I could. Well, I could die from this, couldn't I?
If we don't treat things, then this is an incredibly serious condition. However, over the last decade, treatments for HIV have improved year on year on year. We've got to not acknowledge that with this chest infection on top, you are very unwell at the moment, and being in hospital is the right place to be.
Well, yes, but when you say very unwell, are you saying that I'm at risk at the moment of of dying?
I don't believe that's the case.
No.
You are unwell, and things can be unpredictable, but given how you are today compared to when you came in, I don't believe that is a genuine concern.
But I could catch other things, couldn't I?
I think if we don't treat the HIV, then you are almost certainly going to catch other conditions. Current treatments for HIV are light years away from where they were a few years ago.
Right, okay.
So the number one priority is to involve the specialists who treat this on a day-to-day basis.
Right.
We've got a number of treatments that will help control the virus
Yes.
let your immune system recover, and let you live a normal life. We would
Right.
prefer to think about HIV currently as a disease that you live with.
Oh.
Do you know anyone, for instance, who's got diabetes?
Well, I mean, I've heard of diabetes. I can't off the top of my head think of anybody.
Okay. Well, there are lots of diseases that people have to take regular treatment for,
Yeah,
but by doing so, they can continue to live a normal life.
sort of controlling it.
Exactly.
Yes, yes.
We can't get rid of it, which I
No.
think is an important point to make, but what we can do is control it. And
So-
we've got a range of options for doing so.
If it's passed on, say, to the girlfriend, I don't know how I'm going to tell her this, but if it's passed on to her, for example, she could actually be infected, and she too would also be stuck with treatment for the rest of her life.
I think it's vitally important that we find out for
Yeah,
her
yeah.
sake, as you've said.
But if she is infected, this would be the case.
It would be.
Yeah, yeah.
Now, this is a very difficult discussion to have, and it's certainly not one, if you want, that you have to have
Oh, it's
in
difficult.
isolation.
Yes, it's difficult.
We've got a range of support options,
Yeah.
and we've got, like I said, the specialist team who can help you either thinking about how you want to have that discussion with her or helping have that discussion with you. So that's something that is important, and we really do need to get addressed in a timely fashion. However, it's not something that we have to do today, and it's not something that necessarily you have to do by yourself.
No, but I suppose I have to do. Yeah, no, I have to do it. I have to face up to it myself and tell her. You know, I mean, that's only right, isn't it? Yeah, I mean... Well, you know, I suppose it's my own fault, isn't it? Yeah.
Well, I don't want to talk about any form of blame or anything like that. What I want to talk about is getting you better as quickly as we can.
Yes.
So if I was just to summarise what we're going to do next,
Yeah.
is we're going to involve the specialist team, we're going to carry on the treatment for your chest to make you feel better from that,
Yeah.
and they are going to discuss with you the best treatment to help boost your immune system, to reduce the HIV, and to get you back to living a normal life.
Yeah, well, that's good, but then equally, I've just got to talk to her. And she wants to know how I've got it. Anyway, I've got to do that.
Okay. Is that something you want to talk about now?
No, I'll just have to hope she's understanding, you know.
Okay. Thanks very much, Dr. Ritchie. How did you think that went?
I think in terms of information giving, I was able to explain the reason that he was admitted to hospital. We were able to move the discussion on to the diagnosis of HIV and how we would move the treatment of that forward. And we were able to raise the issue of contact tracing and the need for screening his partner and others. In terms of further discussion, there were obvious signs towards the end of the consultation that he wanted to discuss his possible route of infection. However, that was beyond the scope of the instruction in the scenario, and in relation to time, I wanted to keep the discussion focused on diagnosis and management.
And anything you would have tackled differently if you had your time again?
If I had my time again, I think it's quite hard. His agenda clearly towards the end did become about his route of infection. And although I asked him if there was anything specific he wanted to discuss about HIV, that wasn't volunteered in the early stages. I don't think in this scenario it would be appropriate to, when explaining the diagnosis, to start inquiring about route of infection. So I'll leave it at that.
Okay. Just in particular, the way, because obviously delivering the news, and he did he sort of recoiled and he was quite shocked. How did you handle that?
I tried to give him time. I didn't want to leap in with a follow-up question. HIV is a disease that lots of people will have knowledge or assumptions about, so I wanted to pause for time and let him then lead the discussion. He didn't immediately come back with any questions, so at that point I tried to establish his knowledge about HIV and move the conversation forwards.
And at the end of the consultation there, how was his mental state?
He was quite clearly upset. He's a man who's going to need more support on the wards. As discussed, we're going to involve the HIV specialist team. I think the limitation of time meant that this was not necessarily concluded as smoothly as it could be. And equally, the fact that he had developed a further agenda meant it was difficult to wrap up the discussion well.
Are there any other sources of support for someone with HIV?
In addition to the specialist team, so the infectious diseases or the HIV team, there'll be the HIV specialist nurses, and there are a number of patient support groups he could be directed towards.
Okay, good. I thought you did do some probing about how he might have acquired that, and there was very subtle, gentle probing about what his job was. Did he travel a lot? And I thought that was something you might have come back to when we were talking about then, how he might have acquired it, and also then obviously contact tracing. You introduced yourself very well, and I think the setting for the delivery of the bad news was good. I would perhaps have come to the punch a little quicker. I think there was a bit of a grey area there where initially we're giving him a bit of false reassurance, and I think he was given the impression that, well, it's just an infection and this is treatable, and I think what might have been slightly worried, he was then less worried, which then was then harder to then bring him back to the more traumatic news. And then having told him that he had an infection, and then you were talking about another infection, I think that can be a bit confusing. So it's when patients are trying to receive the information, it's a bit trying to be as precise that you have this and you have this, and I think we want to use
and maybe lead in with the first one.
I think it's in the same way that in the physical examination stations, if distress or discomfort is caused, it must at the very least be acknowledged. And I think that's important, that when he went quiet, when he head went down, I think at one point he took his glasses off, and there's clearly a lot of body language suggesting emotional distress, and that needed to be acknowledged, and he did that, and he checked if it was okay for you to continue. He did use the word happy, which I think we could have probably chosen a different word there, because he wasn't going to be happy at all. I think it's being mindful of the subject's body language after that scenario, and are they actually paying any attention? So sometimes you will continue talking, but it's pointless, because whereas the words have been said, they haven't been heard. And I think, yes, if we had more time getting on to how he'd contracted it, contact tracing, and then he's going to leave here now, and I think it would be useful to establish that his mental state wasn't such that he's going to commit suicide immediately on leaving, but also what's his behaviour going to be like when he leaves here. He clearly has mentioned that he's worried about passing the disease on to his girlfriend, but how should he do that? And perhaps we could have just touched on, what sort of protective behaviour he can actually do, so use of condoms, etc. But otherwise, I thought that was very good, and the offer of support was very good, and it's important that we've involved his specialist team to be looking after him. So this was another delivering bad news scenario. Clearly, it's important to know that bad news isn't always death or cancer. That HIV is another condition which will come up commonly in these exams, knowing that the prognosis of someone with HIV isn't as much of isn't the death sentence it used to be, that we can expect people to live a normal lifespan if they are concurrent with treatment. I think in this was a good case where you saw the emotional reaction of the subject, and it's important to know that sometimes not saying something is going to score you as marks as saying something would, and leaving the subject adequate time to recover from the emotional distress, to ensure that then when you do carry on, that they're actually listening to the information you're giving them.